Well, good afternoon, everybody. Good evening, good morning, wherever you might be in the world. Thank you for joining us. I'm really excited about the number of people here. I'm not going to tell Dr. Vicky how many there are. Just say that it's pretty well attended. So I'll give everybody a couple of minutes to get get settled in and make sure that your sound works and your video works and everything. And then in the meantime, I'm going to go ahead and next slide, please. I want to thank everybody here for supporting Every Cat's mission to improve the lives of cats through research. We have been funding FIP research for 20 years now through the BRIA Fund. It was created 20 years ago this year. We've spent well over $1 million specifically on FIP research. And in part because of that, we now have reasonable treatments available. But there's still a lot of work left to do. We still appreciate anybody helping us fund the BRIA Fund. The QR code that you see on your screen right now will take you directly to the form if you want to go ahead and donate while you're thinking about it. If you'd like to donate during the webinar or after the webinar, please visit the website at www.everycat.org. And you can also make your donation there as well. Without any more waste of time, I'm going to go ahead and introduce our speaker. Dr. Vicky Thayer has more than 50 years background in feline medicine. She is a graduate of Washington State University's College of Veterinary Medicine. She's board certified in feline medicine by the American Board of Veterinary Practitioners. And she was the principal owner of Civic Feline Clinic for 20 years in Walnut Creek, California. And correct me if I'm wrong, wasn't that one of the first feline-only practices in that area, correct?
Yes, in that area.
All right. Dr. Thayer has also contributed to guidelines articles on feline retroviruses. She was also the co-chairperson and panelist for the 2022 publication of the AAFP Every Cat Health Foundation FIP Diagnostic Guidelines, and that appeared in the Journal of Feline Medicine and Surgery. Since September of 2023, she's been involved with the development and administrative activities of the FCOV 23 International Research Consortium. This consortium is working on a programmatic approach to research related to the outbreak of FIP of FCOV 23 in cats on the island of Cyprus. That has actually presented some interesting information and again reminds us that more research is still necessary. She has considerable experience in organized veterinary medicine in the American Veterinary Medical Association and the American Association of Feline Practitioners, now called Feline Veterinary Medicine Association. She served on the board of Feline VMA for 20 years and was president from 1996 to 1998. She's also been on the board of the largest private cat shelter in the Pacific Northwest called Cat Adopt Team, CAT, out of Sherwood, Oregon. She's been on their board from 2015 to 2021. Dr. Thayer joined the board of Every Cat Health Foundation in 2008. She served as executive director from 2014 to 2018, and she currently holds the title of director emeritus for Every Cat Health Foundation. Without further ado, I'm going to turn you over to Dr. Thayer.
Well, thank you, Virginia. I really appreciate it. And hello, fellow cat lovers. My purpose here today is to continue to bring information about FIP to more veterinarians, more cat lovers. Things are changing at, it seems like, a rapid rate in the last few years, and especially in the last 9 months. And as Virginia mentioned, I've had 50 years exposure to FIP, what with assisting in research at Washington State University on FIP, and then also to now with doing something as such as this webinar. And I bear with me today because I am trying to recover from a respiratory infection that seems to want to linger. So I will try and kind of go fast, slow. There's a lot of information to cover. As far as an overview, as we know, feline coronavirus or FCOV has two different biotypes. One is what we call FECV, feline enteric coronavirus, which is a harmless, non-mutated, causes mild GI signs, lives in the GI tract, and is common in cats. Uh, and the other one is FIPV, or the mutated virulent FIP disease source, and it lives in immune cells primarily, or replicates there in tissue and blood and blood vessels. Each biotype has two serotypes, and what's interesting now is that the virologists are really looking at these two serotypes as more genotypes, and they want to see us, move to calling it FCOV1, which is the feline coronavirus. As far as the backbone, it's all feline. Most common type in endemic cat populations, very difficult to culture in the lab. And it's usually the type or genotype that we'll see here more in the United States. Talking with Dr. Brian Murphy a few years ago, he mentioned that all the cases that he tends to treat or include in his clinical cases or trials are all FCOV1. And then there's FCOV2, which is the backbone is feline, but part of the virus genotype is canine combined into the coronavirus. Easier to culture in the lab and study, but it's most often found in rare FIP epidemics and more maybe in Southeast Asia, other parts of the globe. And I'm going to take off my screen and or my viewpoint, and well, I'll leave it there. It's not wanting to show up, but so you can just look at the slides. Feline infectious peritonitis, it used to be, as we know, pretty much almost 100% fatal. Now, with treatment, which we've had inklings of and work on since about 2017, we can now basically, a lot of people say it's a cure. I almost put a question mark there because the clinicians, researchers, are really cautious about using the word cure because they have specific criteria on how they want to term something that's essentially a cure. I love this picture of Luna. She's one of the cats that was in the first GS clinical treatment trial with Dr. Peterson. This was from 2017. She had effusive abdominal FIP and was pretty sick little 4-month-old Savannah kitten. And with her treatment, I mean, Luna's doing great. Almost 8 years old at this point, probably runs the household. But I thought this image looked, kind of demonstrated how you can go from a very sick kitty, the way they were before treatment, to one that has so much energy and being back to being cat-like. FCOV sometimes mutates into FIPV. So we'll see a certain percentage of cases where we'll have internal mutations of SCOV in an individual cat, switch to cell tropism or affinity of the FCOV from gastrointestinal epithelial cells to monocytes or macrophages. These are immune cells that travel throughout the body. But that alone is not enough to see FIP develop. A virulent FIP-associated FCOV acquires the ability to replicate in large numbers very efficiently in the monocytes and macrophages, thus allowing rapid systemic spread throughout the body. Excuse me. And often to the ocular area, to the eyes, to the brain. That's why we have ocular disease and neurologic disease. And activation of the virulent FIP associated FCOV monocytes and macrophages leads to pronounced cytokine production and immune system activation or inflammation. And the picture over to the side, I just like to, show this a really good kind of narrowed down pathogenesis slide that my colleague, Dr. Glenn Ola, on our diagnostic FIP diagnosis guidelines panel put together. And it's just even though it's a little busy, it's a good demonstration of how we end up developing FIP. Clinical presentations, of course, we have FCOV, and as I mentioned, we have the mutations that will occur in FECV in the GI tract. We don't know what all the mutations are in cases to cause this essentially change in tropism. And to FIPV, which is a high virulence FIP associated virus in the cat. And it with FIP, will end up with kind of a continuum of disease form from effusive fluid buildup, primarily in the abdomen, but it can occur in the pleural cavity, pericardial sac, and it can end up in some cases, the effusion will fade away or be reabsorbed, and then the cat shows up with essentially non-effusive or a dry form and potentially switch back to effusive. In between, we'll see ophthalmic cases and neurologic cases. The FECV low virulence virus, it can transmit in the blood, and that's what complicates sometimes our diagnostics at times, because testing can pick up that particular virus. Usually, in most cases, it causes no or mild GI disease. I like to call the cases the many faces of FIP. I have 5 categories of signs. Usually when it comes to treatment, we go with the effusive, non-effusive, ocular, and neurological. But I have, over my years, seen a lot of the, younger cats, early, non-specific, poor doers. And those are like the 2 young cats in the upper left corner that they just don't look happy. They don't look like they feel well, and they're just not thrifty kitties. And we'll see other cases that have jaundice, like the Oriental Shorthair next to them, ocular disease like cortical blindness. The Silver Persian essentially is a neurologic case. That cat had tremors and seizures. We do have video of that on the website with the guidelines. And you can see off to on the right, the black and white cat may not seem very obvious, but that cat had a definite difference in pupil size. And so some of these subtle changes can essentially be present. And we have to look for that when we're doing physical exams. And effusive is probably our primary, maybe 70 to 75% of cases, depending on, if we're seeing an epidemic, sometimes you can see more neurologic cases in an epidemic, that a breakout of FIP. or not non-effusive usually tends to be upwards about 25-30%. Ocular, less frequent. Neurologic, that really depends on, again, location. The FCOV 23 situation in Cyprus, there definitely was a lot more neurological type cases that they determined, sometimes up to maybe low 30% range, when usually it's much lower in other populations. And I find it kind of interesting in a lot of the pictures that I've been sent of cats with ocular disease. It seems like the left eye is the one that you can see disease in a bit more. It's probably just coincidence, but it just interesting that I've noticed in images that I get. And you can get a dermatologic form, as you can see in the upper or the lower right corner. Various clinical signs with FIP is weight loss, and I think I always say looking at weight and how well cats thrive can be a real key to kind of picking up that this is a cat with that's healthy and well, doing well, versus one that's just not feeling right. And it can be very subtle and it can go on for days to weeks. I had one case of a young cat that was 4 months of, and this was before treatment, 4 months of, uh, just shifting leg lameness, maybe fever every now and then, till eventually I could really detect that this cat it was going to be showing up with FIP, which was unfortunate, as I said, because it was before we had any treatment available. Waxing and waning fever, cats not wanting to eat very well, difficulty breathing, swollen abdomen, seems to be oftentimes more common in the younger cats, from what I can determine. And then ocular, you can see an example of that on the left with, the kitty, with involvement there, and ataxia, seizures. Ataxia is one of the more common things, neurologic, that seems to occur earlier in that form. And vasculitis, again, as I mentioned. Here's some examples of young cats with effusion, abdominal effusion, and the samples of what more typical FIP fusion looks like. Very full of protein, very sticky, and yellowish discoloration, kind of, uh, smaller number of cells present. You can do cytology, and in hospital, and that can be very helpful, um, there. And I want to show you some of the cases. This just shows how subtle sometimes some of these cases, especially neurologic. Cats are pretty agile. And with Reaper Roberts, if he kind of, and you'll see it even more on the next video, but he's kind of stumbling, just slowly stumbling, and he doesn't quite have his balance. He looks like somebody went out and had too many beers on a Saturday night and trying to walk on that ledge or jump up there. This is where he's walking across the floor, just a little more ataxic than you would expect to see, and he's not necessarily wanting to eat either. Food's less interesting for him. And this is a case, it's very hard to kind of take just a still image and show a cat that has pleural disease. And you can see how this cat is essentially, breathing, uncomfortable, not has not been grooming, has not been feeling well. Yeah. There we go. And diagnostic overview. I was thinking this morning when I was trying to think about this talk about the consideration of how subtle a lot of the disease you can just pick it out and you can see it and it's pretty easy to diagnose, and other cases can be very complex. And I was thinking, wondering whether we should maybe try and name this the great pretender, the great opportunist, or the great, imitator, but it just seems to kind of fit that it can throw you off at times for a while until you get a better handle on diagnosing the disease. This was part of our diagnostic guidelines, and we felt that this was something that would indicate to people to think about, what you need to do a thorough history, do a good physical exam, consider what tests you need to do, and build, one of the best things, I ever learned was from Dr. Melissa Kennedy, who was on the board of Feline Foundation when I was an infectious disease specialist. And she would often talk, when she talked diagnostics, building an index of suspicion brick by brick. And so we put together this brick cat to remind us to kind of, there are other tests, there are other things to think of when you're trying to diagnose FIP. As I mentioned, getting a good history is an excellent idea. Signalement is important, lineage of maybe a particular breed. Certainly, if you read recent papers, the breeds that seem to show up more would be British Shorthair, and essentially ragdolls. I did read a recent paper out of Japan that they saw more cases in Scottish folds. So you have to keep in mind the population and the type of breed that might be in that area. But certainly pedigreed cats would be one that, an area you'd have to look at. Age, usually, of course, younger cats, less than 2 years of age. But I have heard, and certainly as time goes on, that we're seeing not the bimodal young cats, old cats, but cats that even in the middle age are seeming to show up with FIP. So it's something to keep in mind. Males more than female tend to be also part of the signalement. Physical exam, a lot of times with your history and physical exam, you can pretty much diagnose FIP. If you've seen enough cases, that's certainly helpful. Laboratory tests, you really want to do your basics of a complete blood count, a chem panel with increased globulins, and bilirubin would be one key area. Lower albumin and lymphocytes, your albumin globulin ratio of less than 0.4 or oftentimes 0.6, but you start getting an index of suspicion of, concern. Shall we put the FIP in our differential list? And urinalysis always is a good idea because we can have kidney involvement in some of these cases. Acute phase proteins, or APPs, are something that they do outside the US or are more available, like in Europe. I have talked and seen lab work from cases over in Europe. You can see, acute phase proteins like serum amyloid A being increased and decreased as treatment goes on. The cats are clinically acting normal, or AGP, that's another one, and alpha glycoprotein. And so those are some that, areas that you might want to look at. And it could be that some of the acute phase proteins will come to be available in the US for testing. And there's certainly research being done on how we can monitor and see what if a cat is, responding or back to normal and can be taken off antiviral medications. Imaging is also important because you want to try, if you can find a fusion, you can get a sample of a fusion, you can have a better chance of finding or determining if FIP is present. And treatment trials are becoming really a valid diagnostic. If the cat responds, usually within a week or two, you have a better handle on the fact that this cat likely was FIP, and continuing the treatment present. For diagnostic detection for viral antigen is definitely your kind of the IHC or immunohistochemistry is essentially the gold standard. It's just not done as often because it usually requires biopsies, and in cats that are, critical or just on the edge of how they're doing, and it can take, a number of days to get results back. So it's something that is, can be recommended to confirm a case, but it can be tougher to get. Immunocytochemistry by direct immunofluorescence and on either effusions or aspirated cells like fine needle aspirates and saline. I know in down at University of Sydney, they have perfected this to where they feel that it's as good a method as an IHC to confirm FIP presence. Another consideration is a positive real-time RT quantitative PCR, with high viral load being present with the clinical signs, clinical pathology, highly suggestive for FIP. But we have to keep in mind sometimes it's not going to be absolute because less virulent FCOV can spread systemically in cats without FIP and look much the same. So you have to tailor your diagnostic approach to the specific presentation of the individual cat. And as far as not do, certain tests to not do or consider would be RT-PCR on fecal samples. It only detects whether a cat is shedding FCOV, not the presence of FIPV. A blood sample is not preferred for PCR testing. Usually, you want effusion in tissue. I do know Dr. Katrin Hartman in her last publication in decreasing the length of treatment time. I believe she was doing PCR testing on blood and feels very comfortable that their lab could detect, FIPV. So I need to talk more with her when I get a chance, but she does feel very comfortable for her on determining FIP presence with that particular test. And antibody titers are just checking for the presence of antibodies to feline coronavirus. It's not a diagnostic. I still, I think everybody knows Dr. Peterson's comments that more cats have died from this test because they've been euthanized and they have not had FIP. And so we want to try and not utilize this test. It may be a little small brick down there, but it's not a test that I would, claim to have, look at for part of diagnostics. On our diagnostic guidelines. On the website, there are supplementary material outside the article. There's 16 sources of them. There's the video of a neurologic case, how to perform a Revolta test, uh, performing POCUS, patient, uh, you know, ultrasound diagnostic imaging, a list of main differential diagnoses, and a health-related history questionnaire, a list of risk factors, and some of these can also be utilized for other particular disease or diagnostic measures, preparing diagnostic slides from an effusion, samples of effusion and tissue of FIP and other differentials. So, it's worth checking out, and checking out even for other cases that you might have that's not FIP. Antiviral treatment options. We'll go through this. There are a lot of wonderful webinars out there for you to look at. Dr. Petra Cerna out of Colorado State, Dr. Sally Coggins, Dr. Samantha Taylor have all done wonderful treatment webinars. So always pay attention and catch up, because I sometimes feel like I check something out and a couple weeks later, maybe, the thought may be different. But the International Society for Companion Animal Infectious Diseases is working on treatment guidelines. So they're in progress, and I would keep your eyes open for that. This is a great group to be a member of, and meetings are every 2 years, and probably wish they were more often. It was a great place to hear more about FIP. Current initial recommended FIP treatment. Veterinarians, of course, from June 1st, at least here in 2024, here in the United States, can now prescribe certain compounded antiviral treatments. In the US and Canada, there are still some countries that do not have availability of any antiviral that they can utilize. GS 441524 is the initial current antiviral treatment recommended. I probably refer to it as GS. Remdesivir, the prodrug for GS, is used in Australia and the UK for IV and sub-Q treatment. It's legal to use that in the US if you need to use an injectable. It is difficult to obtain. It's usually through human hospitals, and it's very costly. So it's, something to be aware of if you need to and want to go to an injectable form. Your other options would be off-market injectables that have been present since about 2019. Treatment highlights, they were now switching over to oral treatment for the full course. A number of studies have shown that cats can do well, and equivalent, over numbers as far as can do well for the 84 days, and then their uh, ability to be under observation for another 84 days. And so the cats need to swallow, not to be neurologic, critical, or exhibit reemergent signs. Then you have to really consider, do you switch to another drug, or um, do you go to injectable? And I think a lot of times people are considering returning to potentially injectable form. And but as far as with oral treatment, and as I mentioned, oftentimes there are similar treatment response rate, around 80 to 92% cure rate or remission. So that's amazing compared to when had 5% or less, and most of the cats would not, not survive, certainly not respond to anything. And 84 daily doses are required, followed by 84 days of observation as a baseline. As I mentioned, Dr. Hartman has done a recent study and several hundred cats showing that shorter treatment times are possible, roughly about 6 weeks instead of 12 weeks, though. You probably want to use this sort of shorter treatment for more stable cases versus cats that are neurologic or potentially ocular or, as I mentioned, unstable. Most spay or neuter if cats and kittens still need to have be spayed or neutered at week 10 of treatment if all signs have resolved and after the observation period. If spay or neuter is delayed, usually say GS is continued for another 2 weeks after surgery. And opinions vary on vaccine boosters. I always suggest risk versus benefit, and I have, other than maybe giving vaccines in the cats before they develop FIP, I think sometimes that as a stressor can potentially trigger it in some cats. At least that's been my observation. But I do think once these cats go through treatment, and it's best, like I say, risk versus benefit, after they are done with their observation period, I would do panleukopenia and the rabies vaccines because these are life-threatening diseases. And I can tell you, people are reluctant sometimes to do the rabies vaccines, but it even in strictly indoor cats. I live on the West Coast. I live in Oregon, and you wouldn't think that it necessarily be a concern. But bats get into houses, cats play with them. It's happened right around my area. You don't want to necessarily worry about that. And so I would give strong thought to when they're doing well to updating them on those particular vaccines. No contraindication that I can find to heartworm or flea treatment or routine deworming. The antiviral treatment works. Cats can go into remission with no relapses and live normal cats' lives. This is a list of about 10 of the compounding pharmacies that are available out there that are you can get a prescription for your client or in some instances keep stock in the hospital. Costs vary, may change from what you might see there, probably will. And you need to talk with the pharmacies. I have, I have, as far as disclosure, I have received no honorarium, no funding, anything from any of the pharmacies. So I just, wanted to share the information, for you to see. I do know that a number of the uh, people or the groups that try and help cat parents whose cats have FIP and go through treatment, that they would love to see more veterinarians keep stock in hand if they can. Some states won't allow it. But that's because some of these cats are only days from passing from FIP. And so the sooner they get treated, the chances are they can survive and do well. And so, it is worth considering having stock on hand. Shipping Shipping, can be fine. You can get it within the couple of days that sometimes they mention, but in many instances, shipping can take longer than you think, or a shipment may go lost. And so keep that in mind. I've seen people comment online about not having the product and they're worried for their cat. So that's something to consider. And so, this information, you're probably best to talk with other veterinarians, their experience with the different compounding pharmacies, and, what success that they have as far as the product or working with the pharmacy. I put this up here, Stokes Compounding Pharmacies, the first uh, compounded product out here in the U.S. It has a number of years between. They are utilizing the Bova formula. Bova has done compounding in Australia and the UK, and a number of the studies have been on looking at the effect of oral treatment, GS treatment, and it's usually with the Bova formulation. And so it's something to consider, as far as it's nice to see that the tablets are very small. They now have a liquid suspension, tuna flavored type tablets. You need to check, register with them, prescribe. They have a really good resource page and a lot of webinars and information for you, to help. The tablets are 50 milligram tablets. The dosage amount, usually you're trying to do it once a day, 15 milligrams per kilogram, every 24 hours, or you can divide the dose every 12 hours. And same for non-effusive disease without ocular or neurologic. Ocular signs, usually it's a higher dose of 15 to 20 milligrams per kilogram once a day. Or if you're concerned, yeah, divided dose every 12 hours. Neurologic signs, oftentimes it's better to look at doing a 20 milligrams per kilogram daily in a divided dose, so every 12 hours, just because they tend to be more unstable, and we have to deal with that blood-brain barrier of trying to get the medication up into the CSF high enough to essentially stop replication of the virus. The other secondary line of treatment is EIDD 1931 and 2801, which 2801 is molnupiravir. Wedgwood Pharmacy is carrying molnupiravir availability. And so it usually is considered more a second line antiviral because it has a narrow safety margin. And you can see the dosage off to the left in the different forms. Again, 84 days worth of treatment is recommended. It is lower cost if there's cost constraints, and consider use if a suboptimal response or reemergent FIP. Usually it's not recommended to go above 20 milligrams per kilogram, every 12 hours because of the fact of the narrow safety margin. It is a mutagen. You should essentially handle with gloves. Don't handle pregnant or nursing, should be above 18 years of age. And side effects, you can see it can cause bone marrow suppression, GI upset, loss of appetite. So this is something to keep in mind, but it can be a good rescue drug for the cats that are not responding to GS. and Paxlovid. Again, I have the dosage there. Right now, it's ongoing, going through studies and trials. It's a protease inhibitor. You have to give nirmatrelvir or ritonavir, both. Ritonavir is a PK booster, extends the use of the protease inhibitor, and it's from what I understand, I believe certainly more expensive than EIDD, but it is available off-label for cats, and we do have some pharmacokinetic and pharmacodynamic studies that have been done by Dr. Crystal Reagan out of UC Davis. And you have to be cautious if the cat is on any other cytochrome P450 dependent drugs. Important thing, weigh the cat, weigh the cat, weigh the cat. So they should be weighed weekly. You should watch. Don't decrease the dose if they with weight loss, because sometimes that may be fluid reabsorption, and they have to have that dose increase or a long, or might need a longer treatment time. But it's oftentimes relapse is more likely in the first week or two when people are not paying attention to their weight. The cat, gains weight, is feeling better, and the dosage decreases. So you need to really be careful, weigh the cat. This little scale is a wonderful little one. At Amazon, I have that one here. My cats seem to not mind it because it's pretty stable, very inexpensive, about $25 to $30 through Amazon. And so I think everybody, clients and cat lovers, should have a scale at home where they can track the weight. And I do want to say, and I had to try and put in here, please do not use the antivirals as a preventative for shedding FCOV. We don't recommend it. This is the way we get antiviral resistance. And so we don't want to see people out there giving the antivirals for like 4 or 5 days or like a week, and then stopping the shedding. It will return because the FCOV is very ubiquitous in the environment. So please do not use the antivirals as a preventative, and minimize stress for the kitties, just because they do better. I know I do better if I can minimize my stress. There are other online information resources, oftentimes work together. I have put a few up there. There's handbooks that are digital downloads, some that you can order that are printed. But I think they can, I know that oftentimes Dr. Peterson has looked at it, been asked to give advice and information for the handbooks, and so, or treatment guides. So oftentimes they've been read over and looked over by a number of individuals. So I think it often, when somebody has worries about their kitty at midnight or 2 o'clock in the morning, at least it has information in there to kind of help them work through what's happening, or how they can handle a certain situation, as far as maybe giving sub-Q fluids, parenteral fluids, or giving tablets, anything of that nature, to try and make the cats feel better. Supportive therapy, this is one area I really wanted to end up pushing quite heavily for today, is that a lot of these cats, the antivirals are great, but some of these cats are a bit can be unstable, don't feel well for a while, and they benefit from a short course of oral corticosteroids, usually tapering the dose over 2 to 3 weeks. And they can, corticosteroids, either topically or systemically, can be helpful for more severe ocular or neurologic cases or immune-mediated hemolytic anemia. um, Levetiracetam, and I'm sure I say that wrong, an anti-seizure medication may be needed for seizure management. Eating and drinking is essential. And most of them are starting to eat or drink pretty quickly. And as I mentioned, they're back to eating pretty quickly. This is just showing Reaper Roberts, the kitty who was unstable, but he's, learning to take his pills along with treats, to where, he's, looking for them and, being, more, uh, less against the cat, and with him looking forward to getting his treats. I have a couple other little items that are there. Braun ear thermometer can help people take temperatures at home. Churu for food eating, giving a little treat for the cat with the food. Don't want them to eat a whole meal, but sometimes a small treat is necessary. And pill splitter, this has been a pill splitter that I've seen recommended that can be found on Amazon to cut a lot of these tablets. Mm. And additional medications or treatments, certainly Serenia for nausea, appetite stimulants like mirtazapine, vitamin B12 injections. Probiotics they're being studied, I believe, at Colorado State University as being an adjunct, or, whether they're beneficial with the antiviral treatments. Certainly fluids, antibiotics, we try and avoid recommending metronidazole or fluoroquinolones because they can have, dosage dependent neurologic side effects. So we don't want to give that to cats that are exhibiting neurologic signs. Gabapentin has been helpful for some individuals with cats that are anxious or uncomfortable. And then consider pain management. Just remember the cats are not feeling well, oftentimes are weak. And so, some of like gabapentin or pain medication, you could have increased sedation with it. So you have to moderate how much you give. Here's just an example of Stoli Herman. This cat had abdominal effusion. A week after, you can see his abdomen is definitely smaller, and that's after beginning treatment. And usually effusion oftentimes can reabsorb within a couple of weeks. The end of treatment, many of these kitties have to endure the having their party hat or a little ruffle or just a party graduating from treatment, because the pet parents are really happy to see that the cats are doing well. And then after his, cure date, as they call it, you can see how his coat's so much more different than what you can see otherwise. Here's another evidence of early stage disease. And this is a Noah Demery, and Noah, his buddy's taking care. Noah doesn't care how if he grooms or not. He's not a happy kitty. He's not feeling well. And you can see after his treatment, he's back to, playing. He's got his cat ball, and he's, you know, picking up his little cat toy and knocking it around. So they get back to being very cat-like, pretty quickly. Patient monitoring is important. I like to try and show this chart, gives you an idea what all that you might need to track. Just like when I go to the doctor, I have a my chart online. It's very good to track, what's going on. It helps your veterinarian, anybody else who's help giving support, to just for you to know whether what the trends are as far as appetite and activity and maybe temperature, certainly weight. And this was sent to me a while ago. Now a lot of the groups that help support these cases, they have apps that if you put in a weight, it will tell you oftentimes how much medication to give. And so it's very helpful to at least have something. This is an Excel spreadsheet, but it's useful, for veterinarians to have, for everybody to have, to see how things are going. Monitoring and tests, usually it's been recommended to do a CBC biochemical profile or repeat the tests every 4 weeks during the 12-week period. Sometimes that can be different as far as that part goes. And I know Dr. Peterson feels like maybe they don't necessarily need to be treated, not treated, but tested every 4 weeks, not trying to stress them out. If the cats are clinically acting normal and feeling better, kind of follow what the cat's doing and then, what maybe could see on labs. Over in Europe, like I say, they do consider the acute phase proteins, monitoring those, whether those decrease in value with treatment. You do want sometimes to monitor kidney function, liver function, anemia, blood dyscrasias. If hyperbilirubinemia stays high, total protein stays high, electrolytes, you have to give some consideration. How's the cat doing? Is something else going on? They are seeing, we're looking for any kidney, liver, or sepsis issues that are occurring with cats. There are reported cases that I come across and talk with other researchers about with immune-mediated hemolytic anemia. There are some reports of acute cardiac disease and potentially, it sounds like deaths. These are anecdotal, but there is a study and right now on looking for control cases out of UC Davis on cats, trying to determine if they can detect if some of these FIP cases on treatment, if there's a difference between ultrasound and cardiac biomarkers, from the average, healthy, normal cat. And there are cases of viral sepsis, seem to be pretty serious, oftentimes more difficult to treat. And so, they're not like a bacterial peritonitis, so it appears to be the result of pretty severe inflammation. Brain herniation as an effect, a neurologic form of the disease has been reported. Again, monitor the weight weekly. And, I've heard some people talk about taking body temperature and seeing in some publications that, body temperature may go down, be a little more subnormal before the cats start doing poorly or having reemergent signs. And afterwards, after they do well and continue on doing laboratory work and exams annually is a good idea. Your expected response to therapy, usually appetite's back in a few days. Saw that with Luna, the kitty, at the very start. I knew we had something going on because she was within, I'd probably say 3, 4 days, no fever, eating, and it was like such a turnaround from what you usually see with cats with FIP. Effusions within a few weeks. Usually your albumin globulin ratio, some of these signs will take a little bit longer, like the whole total, 10 to 12 weeks of treatment. But it is good to monitor this. And uh, Dr. Murphy has stated to me that antiviral treatment, rapidly eliminates the coronavirus load. At least it becomes undetectable by 5 to 10 days. So the drugs, the antiviral like GS can work quite quickly. This is a very complicated case that I wanted to point out. I think it's a good one for, how the clients are so invested and love their kitties. And this is Everest. Everest started on oral medication, and I think after 2 weeks from what the email that they sent me, um, she just crashed into neurologic signs. I have longer video of her, but this is one where she is demonstrating seizures. She was at the emergency hospital probably for 7+ days. They almost gave up on her, but this kitty really wanted to make it, and she is doing better, being weaned off medications. The last I heard from them, but um, they persisted, and you can see how serious the neurologic disease can be. But like I say, the clients were really dedicated to her. So don't give up if you can help to avoid that. Possible delayed or suboptimal response is over here on the left. Usually, if you go with fever and inappetence, longer than 2 to 5 days, you know, you you probably want to start thinking, do I need to look for a different differential, a different treatment? Reevaluate. It's always good to reevaluate and see what, did you miss something? Why is this not, the cat not responding as well as you'd expect? And points for consideration: monitor, record any clinical signs, changes in behavior, weight, body temp, and labs. Be aggressive and begin treatment quickly if the patient more likely than not has FIP. Small percentage of patients develop reemerging signs of FIP on oral antivirals and may need to switch to an injectable form of GS or another second line antiviral medication. And if they're not improving, switch, as I said, to like maybe EIDD 1931, molnupiravir, or Paxlovid would be another option down the way. Don't, and then one consideration that I know I've heard Dr. Peterson even bring this up is that if the cat's clinically normal, doing really well, don't keep chasing all the laboratory values to return to normal when the patient is fine. Don't keep trying to continue on with the antivirals at 80 past 84 days if the cat's doing really well, and maybe there's just one value that's taking a little longer to return to normal. Good to monitor the cat, but it sometimes becomes very costly for clients. So keep that in mind. And please share the FIP is treatable message. I really believe that cat parents want options. I've seen this, I've heard this. The cats want to live, and cats have, every cat has a name and is cared for, just like Everest. And want to cover just a little bit. I'll try and make it quick because I know we're just past time a little bit. The FCOV 23 FIP outbreak in Cyprus cats, because this is something that's come up in the last few years, a concern. Cyprus is a cat-loving island in the Eastern Mediterranean, as we know, and the cat population on the island is 1.5 million. They started seeing in 2022 increased numbers of cats with FIP. They have seen an estimated about 15,000 plus cats that have been affected that they have been able to test. There's probably thousands more, most likely, who weren't able to be confirmed FIP. 28 to 40% of the cases have been neurologic at one point, and they developed FIP more quickly, and then more of the older cats too. They saw cases in indoor cats only, which was a huge concern. Highly transmissible and pathogenic. When they go and look at tissue samples, epithelial cells of the colon had large amounts of virus, which was being shed in feces, and it's being sequenced genetically. Most of the virus is the backbone, as they call it, is cat coronavirus, but the spike protein is recombined with a highly pathogenic canine coronavirus that was seen in 2005 in puppies over in Europe, especially in that region, that killed a lot of puppies. So this has been a huge concern. We don't want this to spread to other areas. It has been seen. There was a case that was treated, fortunately, I think successfully in the UK, that had been taken there, adopted and taken there. Bulgaria. So, we don't want to see this get spread to other regions of the globe. And it may, we're still trying to determine, it may not require the mutations to change tropism. So maybe more directly transmissible where FIPV is not considered to be the case. And the cats were treated molnupiravir and the Bova GS. That's usually what they have available now. So far, it appears that it's responsive, but that's part of the our one of the project's programmatic research approach underway with sponsorship by Every Cat Health Foundation and Morris Animal Foundation. Donor support has made this possible. I'm just what I call myself a cat herder to get everybody to the Zoom meetings. These are awesome people. They collaborate. They are, wonderful individuals, brilliant, and we're working on finding answers on how to look at these, significant epidemics that can happen. It's 12 individual projects. When we say programmatic, it's looking at FCOV, 23 altogether within one program versus individual projects all, being done at different times. We coordinate and work on this. There is a website for some of our consortium members that are doing research out of Greece and Cyprus, getting cases and samples. And there's our logo. We're working on getting a website being developed for the FCOV 23 consortium. And these are some of the cats on Cyprus at a shelter. The young lady there is doing a videography of the shelter. And they're they just love cats over there. I hear that, how they're treated, everything. It's quite a bit different than what we're used to here. The community is very involved. FCOV 23, I just had to show these because Dr. Gary Whitaker sent them to me or gave me info about it. This is a three-dimensional look of the virus. We always look at things in one dimension, but this virus, like I say, it's been concerning because it's very fusible with receptors, and they haven't seen one be quite so you know directly fusible and causing illness. Uh, on the right is a nanopore portable DNA RNA sequencer. These are taken out in the field where you can tell if you have FCOV1, similar virus maybe to cases 20 miles away or another shelter or something of that nature. So this is some of the future technology that uh, we're going to see in telling us more about FIP in the future. Here is, some of the shelters and the cats. The number of the cats live in the monasteries there on Cyprus. And I just love this picture of the cafe cat there. I believe this may have been in Nicosia, Cyprus. But they're very people-oriented kitty cats. And some more of the cats at the different shelters. And they're well taken care of from what I understand. And some of them have several hundred cats there at their particular shelters. This is just, I'm was going to take this slide out, but Virginia convinced me to leave it in because if you go back and she's going to have this up on the webinar up on YouTube, that these are some of the research, uh, that's out there by every cat or published or, or at other universities that shows what's going on with research, where we're focused at, and that that it doesn't just stop with treatment, but we have to learn a lot more. The more we learn, I think the more we'll, have questions and need to find the answers. And together we'll defeat FIP forever. I believe that. I thank Every Cat Health Foundation and the Bria Fund, Susan Gingrich, who's been a good friend, started the Bria Fund as 20 years ago this year. And Dr. Peterson, who's definitely been a pioneer in infectious disease in cats. The other researchers, we always wondered who was going to take over for Dr. Peterson when he retired. And I can tell you, there are excellent, excellent researchers out there that are uh, going to be that are working now and will fill his shoes and carry on. So, and thank you. You can, address questions to me. I could probably do a few today just because my voice is going to give out having this respiratory infection. But I will turn this over to Virginia.
Okay. All right. Real quick here, to request a veterinary CE certificate, please email your full name, veterinary license number, and state or province of issue to webinars@everycat.org, and I will get that to you hopefully by next week. My goal is to get this recording up on our YouTube channel early next week. I am going to be, Dr. Thayer has kindly provided a handout with a lot of references and a lot of different resources that are available. So I will email that to all of the attendees just as soon as we get offline here. Now, I know we've run a little bit over, but there are just a couple of questions. Dr. Thayer, if you're okay to answer just a few, are you okay with that?
Sure.
Okay. The first one I want to ask about is recurring neurologic problems. This viewer says that their cat recovered from neurologic FIP in 2020, but in 2024 started having trouble walking and gradually got worse. A brain MRI was done. She's seen the neurologist, and they've tried retreating for FIP using both GS and EIDD 1931. Do you have any thoughts on that? I mean, is that something that's seen?
I'm hearing a little bit more, certainly about that. It seems like, from what I'm on some of these cases, it may be a case of being persistent, certainly trying maybe another one of the different antivirals, giving maybe a slightly higher dose if, depending on which antiviral you're using. And then it may be in some cases just again treating longer. You don't want to overtreat or too long, but I have seen people contact me and some of these cases just take a while to clinically be normal. And it's really can be harder with the neurologic cases. They're doing research with what's called TDM, target dose monitoring. And, you know, if we get that refined, and I know Dr. Danielle Gunn-Moore is one person looking at that, is that they're trying to determine in situations like that, how long the drug is it reaching therapeutic levels in the CSF, where we'd expect it to be past the blood-brain barrier, and they're long enough, to essentially stop replication of the virus. So in a situation like that, maybe TDM might be useful.
Okay. Um, on the image there where you were talking about the compounded drug, you said there's also an oral liquid that they can compound, correct?
A number of the pharmacies have a liquid like
Oral,
Stoke. Yeah, oral. Yes.
not injectable. Okay, just
Yeah, not as far as I know. I think we don't have a compounded injectable that's not off market.
right, right.
And whatever source you use, always double check, because we don't know what the bioavailability of that product is, what their recommended dosing level is, whether it's 15 milligrams per kilogram, say for Stokes, their GS, if you went off market, you might be giving a lower level, like 10 milligrams per kilogram, just because the bioavailability of GS in the product is different.
Okay, so important to know even if you're using a compounded drug or an off-market drug, follow that particular drug manufacturer's guidelines.
Yeah, recommendation or who's doing it. I think I do know that I've been, people tell me they really love to see a compounded injectable, because remdesivir is around, it's available, but it's just not easy to come by and not cheap to use. And they'd give anything to have something for those cases that might do better, with an injectable versus oral.
Well, I mean, at some point, and those cats are just those ones that are a day away from point of no return, injectable would be, I think, more
Yeah,
efficacious.
yeah, that seems to a lot of them do seem to come around. And like say, Everest is doing really well. She's almost weaned off her drugs, her anti-seizure medication, and she was just seconds, I think, from not being with us. So they can recover.
You did mention at one point about giving a daily dose, and then you mentioned giving or dividing it into two daily doses every 12 hours. Is there any guideline or specifics that you use, or is that like the preference of the owner, or is there any difference between one daily dose versus dividing it into two doses? I guess is the question.
Yeah, I think it's more the cat's clinical picture, if they're stable or not, and if they have ocular disease versus neurologic disease. I do, I hear not uncommonly that Dr. Peterson thinks that once a day dosing is for most of these cats is just fine because most of them do quite well. But if they're unstable and they have neurologic disease, certainly twice a day is worth, considering and treating that way.
Okay. And that would be something that you discuss with your caregiver, correct?
Oh, yeah, your veterinarian, yes.
This is an interesting question, and then I think this is going to be the last one because we're going to let Dr. Vicky go back to bed. Um, um, if you just because of that, there are plenty of questions here. She did include her email address, and if your question doesn't get answered, she did say you're welcome to email your question to her, and she'll get back to you as soon as she possibly can. But in the meantime, like I said, this last one I want to ask: has there been any research into ivermectin, topical ivermectin as a therapeutic?
Well, I would say not necessarily that I've seen recently, and I just don't think it was something that I always trust people, researchers like Dr. Peterson, especially if he's looking for something to treat FIP with, and he's not been a fan, to pursue ivermectin.
Um, okay, but there is so much research going on right now.
Yeah,
It might not, I would recommend to this viewer to keep an eye on all our research updates and so forth, just to see if somebody
yeah.
proposed.
And there's a lot of research that's being done. I mean, there are companies in the, over in Asia and East Asia who are looking at vaccine development. There's probably a lot of companies that are still looking at other antivirals, and we need those because everybody, all the researchers feel we're going to run into resistance issues.
Well,
And
resistance
yeah,
and or mutation, just like we saw in Cyprus.
yeah.
Uh,
So it's
that's
we need other tools, no question.
Yeah, and that's a perfect segue into. I just want to say that when the outbreak happened in Cyprus and we became aware of it, because we had the Berea Fund, we had money available that we could apply to the research on the ground there right away. We were one of the first places that provided money for studies. And so that is because of our BRIA fund. So I did put a link in the comments or in the chat to the BRIA fund if you want to give directly. Otherwise, you can use the QR code that you see on your screen right now, and then just select the BRIA fund on the form. But again, the BRIA fund, I think, has been instrumental in making the strides that we have in dealing with FIP. When I started in veterinary medicine, FIP was a death sentence, period. That was the end of the discussion. And there's so much hope now that it's overwhelming sometimes. So I'm very excited about that. As I said, we have the recording will be up just as probably early next week as soon as I can get it edited down and everything up. I am going to be emailing a list of resources that Dr. Thayer has kindly provided to everybody on this on the webinar. So watch in your email. If for some reason you don't get one and you did attend it, please reach out to me at webinars at everycat.org if you don't get that resource. In the meantime, too, thank you, Dr. Thayer. Next time we do this is definitely going to be a 2-hour webinar because I think
too much information. There's so much out there, and so many years we didn't really advance the ball very far. And now it's like every time you turn around, something is, could be said. It could be said.
Well,
So
and there is so much that I'm finding that the veterinary profession is still catching up on what's available and how they can treat it. And so, as she said, please share this information with everybody you know, that this does exist and that there is treatment, potential treatments available. So with that said, I really appreciate everybody being here. Thank you for staying extra. And I will get the recording up as quickly as I can. I'll get that email out with Dr. Thayer's resources right away. Thank you, Dr. Thayer. Thank you, thank you, thank you.
thank you, Virginia.